Vampirina, thanks so much for coming on the show.
Thanks.
How did you get interested in our topic of blood thinners?
So, I don't drink blood. I have some friends who have different lifestyle than me. They said some people had gross, watered down blood who were on blood thinners back in the 50s and 60s. Now they're complaining that there's new gross flavors that they really hate. Why is that?
That's an interesting question. And in today's episode, we're going to talk about three things. One, how clotting and thinning of blood works. The three most common reasons why people are on blood thinning medications. And three, why blood thinners taste differently to vampires starting in the 2010s.
Okay, so how does clotting?
Good question. Say someone starts bleeding, we eventually stop, but why? There are factors in our blood that signal that we need to make a clot in order to stop the bleeding.
That sounds like a good thing.
For that situation, it is.
How many factors are there?
Well, there's a whole cascade of factors that activate and work on other factors.
That's a lot. Why would someone want to take blood thinners?
One of the most common reasons is from an abnormal heart rhythm called atrial fibrillation.
What's an atrial fibrillation?
This is when part of your heart called the atrium is not squeezing properly.
But why would you need a blood thinner for that?
If it's not squeezing well, blood might stay there for longer. The longer blood stays still, the more likely it is to clot.
Why is it bad to have a clot in the heart?
The first thing the heart pumps blood to is the brain. If there's a big enough clot that it blocks blood flow to the brain, then you can have a stroke.
That's not good.
Right.
Oh yeah, I think I remember. Some vampires say they avoid eating people with funny heart rhythms.
Interesting.
They also said something about people with clots in their legs.
Ah yes, that leads us to talk about DVTs.
Might as well watching DVDs. But
I mean DVT, or deep vein thrombosis.
oh, what is that?
The heart pumps blood through arteries to organs and it returns through veins. Veins are much more loose and floppy than arteries. Sometimes you can get a clot there, most commonly in your legs.
What causes those?
There's a lot of factors, but most common include being stationary, recent surgery.
Okay, and you have to be on blood thinners
So vein leads back to your heart, which first go to your lungs.
so you don't get a stroke?
If you have a clot in your legs, a little piece can break off and become an embolism and go to your lungs, which causes death of the lung tissue.
Is that serious?
Depends on how big it is. Some people have it for months and don't even know it, and sometimes they can be fatal.
Oh my.
Yep, so if someone has a DVT, then we have them on blood thinners to prevent a PE from happening.
What exactly are blood thinners?
Another term is anticoagulants, since these block coagulation or clotting factors.
Okay.
Here's an overview of the factors, but I don't expect you to remember them at all.
Oh good.
Warfarin, or Coumadin, is probably what your vampire friends first started tasting in the 50s and 60s.
It blocks those factors?
Yes.
How thin does your blood have to be?
We track what's called an INR, or an International Normalized Ratio. The average blood thickness is 1.0. The higher it is, the more thin your blood is. 2 to 3 is where we want for most conditions.
Seems simple enough.
Except it's finicky. It goes up and down. What you eat can affect it, such as spinach and grapefruit, and you have to get fairly frequent blood tests, sometimes even weekly.
Weekly? Yikes.
Starting in the 2010s, some new drugs, sometimes called direct oral anticoagulants, or DOACs, were developed. Two of the biggest are apixaban or rivaroxaban. You take a pill, no more blood tests, no constant medication adjustments.
Oh, so that's why they're tasting something new.
Right. The downside is they're much more expensive, and you can't give an antidote if there's an overdose like vitamin K for warfarin.
Oh, so all these changes
people naturally feel hesitant to start a blood thinner, and there are risks of bleeding with falls. We use different metrics and scores to calculate the risks of brain bleeds and compare them to the risks of strokes and other things.
Sounds like it's not black and white.
Exactly. Well, that's just a quick intro to blood thinners. Hope this has been a little bit helpful.
Oh, this helps a lot.
Great.
Like you said, I don't drink blood, but it helped to understand my fellow vampires.
I think it's always good to try and put ourselves in others' shoes.
You betcha. Well, Vampirina.